How would you feel if you could get a diagnosis, a prescription, and a follow-up from your smartphone? How would you feel if AI could prevent a pandemic by predicting the spread of diseases, tracking the contacts of infected people, and designing new drugs? What if I told you that it is not something that will only happen in the future, but a reality that is transforming the hospital and health industry as we speak? And the technology that's powering these dreams? Artificial intelligence. Hello and welcome to our channel. In this video, we will be sharing with you 10 ways AI will be changing the hospital and health industry and what it means for you and me. Come along with us as we delve into the exciting future of AI. Starting from number 10, nurse robots. Do you know that there are not enough nurses and caregivers in the world? It's true, the World Health Organization says that we need 9 million more of them by 2030. That's a big problem, especially for people who live in rural areas or poor countries. So, how can we fix this? Well, one possible solution is to use robots that are smart and friendly. They have AI and sensors that let them talk to patients, doctors, and even other machines. They can do things like giving medicine, taking blood tests, checking blood pressure, and helping people move around. For example, have you heard of Moshi? Moshi is a robot nurse that was made by Diligent Robotics. Moshi is very helpful and kind. It can do tasks that are not related to patients, like getting supplies, delivering samples, and cleaning rooms. This way, human nurses can have more time to do things that are more important and difficult. Moving on to number 9, AI friends. Loneliness is a serious problem for many people who are hospitalized, especially during the pandemic. According to a review of studies from China, patients who were hospitalized during the SARS and COVID-19 outbreaks experienced similar psychological symptoms, such as loneliness, anxiety, fear, distress, and depression. These symptoms may lead to other problems, such as insomnia, that will make the physical illness worse. One possible solution to help the patients is to use AI friends. An AI-powered provides emotional support and companionship for the patients, especially those who are lonely or isolated. Pepper, a semi-humanoid robot developed by SoftBank Robotics, is one example. It can entertain patients with jokes, games, and stories, as well as educate them about their health condition and treatment. Pepper can also help patients stay connected with their loved ones by using video calls, social media, and email. But hold on, before we continue, if you are enjoying this video, please hit the like button. And don't forget to subscribe to our channel so we can explore the exciting world of artificial intelligence together. Next on the list. Number 8, improved hospital bed management. In hospitals, one big problem is making sure patients move through the system smoothly, getting in, moving around, and leaving at the right times. A crucial part of this is managing the availability and use of beds. Different types of beds, where they are, and what they're for all play a role. If there's a mismatch between how many beds are needed and how many are available, it can cause problems like overcrowding, delays, and unhappy patients and staff. Now, here's where AI steps in to make things better. AI uses data, predictions, and smart learning to figure out how many beds are likely needed and when. It then creates plans to assign beds in the best way possible. AI also takes care of some of the boring tasks, like updating bed statuses and sending alerts. Plus, it gives hospital managers and doctors a handy dashboard that shows what's happening with the beds in real time. Let's take a look at a cool example. The NHS AI Lab Skunkworks team, along with AI experts from the faculty, teamed up with Kettering General Hospital. They wanted to test the AI tool that could use past data to predict how many beds would be needed and suggest the best way to use them. The goal was simple: make sure each patient gets the right bed at the right time to receive the right care. After 14 weeks of testing, the project is considered a success, and we can expect it to be widely adopted in the future. Number 7, faster diagnosis. A quick and accurate diagnosis can make a huge difference in the outcome of a patient's condition. However, manual diagnosis can be slow, tedious, and prone to human error. For example, it can take hours or even days for a radiologist to analyze an X-ray, a CT scan, or an MRI image and identify any abnormalities or signs of disease. This is where AI can help. AI can analyze the images taken from the patient and compare them with millions of other images in its database. It can then detect any patterns or anomalies and provide a diagnosis in a matter of seconds. AI can also learn from its own mistakes and improve its performance over time. One example of how AI can help with faster diagnosis is ADOC, an Israeli technology company that develops computer-aided simple triage and notification systems. ADOC has obtained FDA and CE mark approval for its advanced algorithm for diagnosing such as stroke and pulmonary embolism. Their algorithms are in use in more than 900 hospitals and imaging centers worldwide. Number 6. Self-driving capability in healthcare. You know, getting from one place to another during a medical emergency or just for regular checkups can be a bit of a challenge, especially for people who have a disability. And AI-powered self-driving wheelchairs can easily solve this issue. One such example is the connected driverless wheelchair, developed by the Singapore-MIT Alliance for Research and Technology, SMART. This wheelchair can receive transportation requests directly from the hospital information management system, pick up patients at their beds, navigate autonomously through different floors, avoid obstacles, communicate with elevators, and drop patients off at the designated operating room. AI can also integrate it into ambulances as demonstrated by the ERKA ambulance, a pod-like vehicle that can navigate through crowded city streets and provide medical care to patients in emergencies. Developed by ERKA Engineering, the autonomous ambulance also has a drone that can scout the traffic situation, as well as deliver medical supplies or equipment if needed. Number 5. AI will make healthcare facilities more efficient. Imagine going to a hospital and getting the best care possible without wasting any time or money. Sounds too good to be true, right? Well, not anymore. AI is here to make healthcare facilities more efficient by streamlining the processes, managing the resources, and automating the tasks. AI can use the data from various sources, such as electronic health records, sensors, and surveys, to forecast the demand and supply of beds, staff, equipment, and medications, and distribute them accordingly. AI can also help book appointments based on the availability of doctors, the severity of the cases, and the preferences of the patients. AI can also handle tasks such as billing, coding, transcription, and reporting, which can save time and money for healthcare providers. One example of how AI can make healthcare facilities more efficient is the case of Humber River Hospital in Toronto, Canada, which is known as North America's first fully digital hospital. The hospital uses AI to monitor the patient's vital signs, track the inventory, control the temperature and lighting, and communicate with the staff and visitors. The hospital claims that AI has helped them reduce the length of stay, improve patient satisfaction, and lower operational costs. Next, let's look at number 4. AI Virtual Doctor. It's not always easy to find a doctor, and sometimes you just want quick answers. That's where AI steps in, taking the form of your virtual doctor, ready to assist you anytime, anywhere. An example of an AI virtual doctor is Babylon Health, a UK-based company that offers a mobile app that allows users to check their symptoms, chat with an AI virtual doctor, and book appointments with human doctors. The AI virtual doctor uses NLP and machine learning to analyze the user's symptoms, medical history, and lifestyle, and to provide personalized and evidence-based diagnosis, treatment, and care advice. The AI virtual doctor also explains its reasoning and confidence levels and provides the user with the option to consult with a human doctor if they are not satisfied or comfortable with the AI virtual doctor's suggestions. Number 3. AI will enable SelfCare. Staying healthy is more than just going to the hospital when you're not feeling well. It's about avoiding the need for hospital visits altogether. The tricky part? Sometimes, we don't have the right information to take care of ourselves. But here's where AI comes to the rescue. This problem can be easily handled with the use of wearable biometric monitoring devices, like an Apple Watch, integrated with advanced AI. These devices have sensors that measure aspects of your body, such as heart rate and body temperature, and keep track of your physical activity. The information collected by these sensors can give valuable insights into your overall health. Now, AI isn't just watching over your health, it's also giving you personalized tips for a healthier lifestyle. It might suggest exercise routines, dietary changes, or even remind you to take a break when stress levels are going up. What's more, AI can play a crucial role in early diagnosis. By analyzing patterns in your health data, AI can spot irregularities that could indicate the start of an illness. This early warning system can make a big difference, allowing you to address potential health issues before they become serious. Moving on to number 2. Drug development. Do you know how long it takes to develop a new drug? Well, it's not a quick or easy process. It can take up to 10 years and cost billions of dollars to find a molecule that can treat a specific disease, test it in the lab and clinical trials, and get it approved by the regulators. And even then, there's no guarantee that the drug will work for everyone or have no side effects. That's why we need a better way to discover and design new drugs. And that's where AI comes in. AI is a game changer for drug development. It can help us find new drugs faster, cheaper, and more effectively. How? By using machine learning, AI can analyze huge amounts of data, generate novel molecules, predict their properties and interactions, and optimize them for safety and efficacy. AI can also help us personalize the drugs to each patient, taking into account their genetic and biological differences. One example of a breakthrough drug that was created with the help of AI is DSP-1181, a treatment for obsessive-compulsive disorder. This drug was designed by a UK-based company called Exscientia, which used AI to generate and screen millions of potential molecules in just 12 months, compared to the average of 4 to 5 years for traditional drug discovery. DSP-1181 became the first ever AI-designed drug molecule to enter human clinical trials in early 2020. And finally, number 1. Preventing pandemics. Pandemics, one of the biggest threats to humanity since the dawn of civilization. There were countless outbreaks of infectious diseases that spread across countries or continents, affecting millions of people and causing severe social and economic impacts. Think of the Spanish flu, the Black Death, or the recent COVID-19. But how can we prevent these devastating events from happening again? Well, AI can be deployed at the forefront of identifying emerging health threats before they become widespread. By using machine learning, AI can analyze huge amounts of data from various sources, such as medical records, social media, news articles, and environmental sensors, and look for patterns and signals that indicate a potential outbreak. AI can also help us understand the characteristics and transmission of new diseases and suggest the best ways to contain and treat them. One example of how AI can help detect new diseases is the case of COVID-19. In late 2019, an AI system called Blue Dot, which monitors global infectious diseases, was able to alert its clients about a cluster of unusual pneumonia cases in Wuhan, China, days before the World Health Organization officially announced the outbreak. Another example is the case of Ebola. In 2014, an AI system called HealthMap, which tracks global health events, was able to detect the first signs of the Ebola outbreak in West Africa 9 days before the WHO declared it a public health emergency. As you can see, AI is changing the hospital and health industry in many ways, from improving the efficiency and accessibility of healthcare to supporting public health functions in general. The future of AI is very exciting, at least in the health sector, since AI might also be a threat to humanity. If you want to learn more about AI and its impact on various industries, why not check out other videos on our channel? We have tons of videos that might interest you. And if you enjoyed this video, please give it a thumbs up. As always, thank you for watching, and we'll see you in the next video.